How do you know a child's temperature is normal? Imagine trying to figure out if your child's fever is just a small bump or something more serious. Knowing what a normal temperature looks like is key to managing childhood health at home. A child's normal body temperature usually hovers around 98.6 degrees Fahrenheit or 37 degrees Celsius, but it can vary a little depending on the time of day, how you measure it, and the child's individual body. Typically, normal temperatures in children range from about 97 degrees Fahrenheit to 100.4 degrees Fahrenheit, or 36.1 to 38 degrees Celsius. If you measure your child's temperature rectally, which is considered the most accurate for young children, a normal reading is usually between 97.9 and 100.4 degrees Fahrenheit, or 36.6 to 38 degrees Celsius. Oral measurements tend to average around 98.6 degrees Fahrenheit, with a normal variation from 97.6 to 99.9 degrees Fahrenheit. Underarm or axillary temperatures are generally a little lower and less precise, so they might not be as reliable for exact readings. Ear or forehead thermometers are also used but can sometimes vary in accuracy depending on how they are used. It's important to remember that body temperature naturally changes during the day. In the morning, it might be around 97.4 degrees Fahrenheit or 36.3 Celsius, and it can rise to about 99.6 degrees Fahrenheit or 37.6 Celsius in the late afternoon or evening. Each child has their own normal baseline within this range, so knowing your child's usual temperature helps you better understand when something might be wrong. A temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher, measured rectally, is usually considered a fever. Mild increases in temperature can happen for reasons other than illness, like physical activity, overdressing, or being in a warm environment. So, it's not just the number that matters, but also how your child is acting. Beyond the temperature reading, pay attention to other signs. If your child is irritable, lethargic, refusing to eat, or showing other symptoms like rash, difficulty breathing, or persistent crying, these could be signs of illness even if the temperature is only slightly elevated. If your baby younger than 3 months has a rectal temperature of 100.4 degrees Fahrenheit or 38 Celsius or higher, it's important to seek medical care immediately. For older children, temperatures above 102.2 degrees Fahrenheit or 39 Celsius should be monitored closely. If the temperature reaches 105 degrees Fahrenheit or 40.5 Celsius or higher, urgent medical attention is necessary. Also, if a fever lasts more than a few days or is accompanied by concerning symptoms, it's best to consult a healthcare professional. In summary, knowing if your child's temperature is normal involves using the right thermometer, understanding the typical temperature ranges and daily fluctuations, and observing how your child is feeling overall. A temperature between about 97 and 100.4 degrees Fahrenheit or 36.1 to 38 Celsius is generally normal. Anything above that, especially if your child shows other signs of illness, should be evaluated by a healthcare provider. Always remember, when in doubt, consulting a medical professional is the safest step to ensure your child's health and well-being.